In September of 2023, I started having really bad back pain that radiated through to my chest. I went to my doctor and nobody really could figure out what was wrong, so I went and got pain shots in my back, but they did absolutely nothing. My intuition told me something is not right. So I went to my wonderful internist, who is Juliet Asher. She works at Piedmont, and she ran a bunch of blood work, and the next day called me and said, "You need to go to the ER right now. Your liver enzymes are extremely high." And I'm like, okay, I'm like not thinking anything. And so I call Andy, he comes home, we go to the ER, had the nicest doctor. And so I go do the CT scan, and I could see him coming into the room, and I could tell by his face that it wasn't good. He's like, "Your CT scan revealed you have a tumor on your pancreas, and we believe that it's cancerous." Andy just broke down and cried.
I just couldn't believe it. And I just was in shock.
The next thing I know, I'm being wheeled into an operating room to have a biopsy. And I do remember being on the table and saying, "I don't know what I'm going to tell my children." I kept saying, "My poor children, my children."
And all of a sudden, I'm on a flight home to kind of, receive a foregone conclusion that she has a cancerous mass. It really just rocked all of us.
I just remember, my whole world, crumbling and being like, that's crazy.
Allie came before Andy did, and she sat with me, and that's when I met Dr. Page. Dr. Page came in, so compassionate and empathetic, and he said, "I hate to tell you, but you have stage 2 pancreatic cancer." My son, who's really strong, he just broke down, and so did my husband and my daughter, and I'm the one not crying, though. I don't think it really hit me. Everything's uncertain, and it's like you're in a tidal wave and you're just being tossed and turned all over, and you're like, how am I going to get out of this? And am I going to live or am I going to die?
It's earth-shattering, right? One thing that I was able to walk away with my head held high after the diagnosis was that Dr. Page emphasized how important it was that it was only stage 2. So something that I was able to, walk out with after, the world is crumbling around me, is that we have a chance here.
Sherron's treatment required a Whipple. Whipple's a big surgery, which is when you move the head of the pancreas. A lot of complications, well established. I expect it was probably a relief for her getting through that surgery, because without the surgery, the chances of getting to a cure are very, very limited.
2 months after her Whipple surgery, and she was able to make it out to Dallas for my graduation, which was incredible. It's really cool. Sorry. It's hard, but participate in the festivities, and it's cool.
The last night of his graduation, me and my mom had a moment where we weren't sure she was going to be at my graduation. And both of us were just really upset and crying, because pancreatic cancer has such a low survival rate. And the odds were that she would be dead by my graduation. Seeing what they've had to go through is, for me, the hardest part. Because I didn't want this for them.
So our journey has been twofold. We've had amazing experience with Piedmont. And I'd say that experience led us to find out that Piedmont had some limitations, and Atlanta has some limitations with regard to pancreatic cancer treatment. So we, after doing a lot of research, decided to get some treatment in Arizona. Dr. Page said, "I think you should do it."
For me, doing this clinical trial, it involves me going to Arizona every week, then coming back. It's so difficult, and I am so blessed that I can do that. I'm so grateful. But There are so many who cannot, and they're dying.
A fundamental, foundational element of our program is to try and bring access to research to all of our patients.
There is hope because we're trying to get all this stuff to Piedmont, the clinical trials, the research. There's so many things that are just right on the bubble that are about to pop for pancreatic cancer. But if we could get the funds, they might pop a little sooner, and I feel like I'm gonna benefit from that. I don't wanna give up. I wanna keep fighting and just try to be a light for somebody who's really in a dark place.
We're very excited about the early detection pancreatic cancer clinic. Unfortunately, there are many, many patients in the Southeast, especially in Georgia, that are getting missed. And this clinic will be a way for non-specialists, urgent care, APPs to send patients here to get the latest and greatest evidence-based guidelines and to also be part of research to develop screening tools for pancreatic cancer. There's nowhere else in Georgia, probably along the whole East Coast up to the Northeast, where you can get something like that. So this would be the first of its kind. And I know with the right funding, we can make it happen for all patients like Sherron.
It means saving lives. It means giving kids like me more time with their mom and dad. It's life and it's hope.
Hope can heal you. I've been doing this for almost 2 years. And if this clinic could help one person from avoiding all of this, I would think just that in of itself is worth it.